Visceral anatomy and conditions. The human abdomen is divided into regions for the purpose of study, diagnosis, and therapy. The quadrants are referred to as the right upper quadrant, the left upper quadrant, the right lower quadrant, and the left lower quadrant. The right upper quadrant includes the liver, pancreas, kidney, and lung. The left upper quadrant includes the heart, spleen, kidney, stomach, and lung. The lower right quadrant includes the appendix, ureter, bladder, colon, and gonads. The left lower quadrant includes the ureter, bladder, colon, and gonads. Referred pain is also called reflective pain and is pain perceived at a location other than the site of the painful stimulus. An example occurs when there is pain felt in the neck, shoulders, or back rather than in the thorax or chest during a heart attack. There are several proposed mechanisms for referred pain, but scientists have not yet discovered the true cause for this phenomena. Some examples include ice cream headaches or brain freezes. This is an example of referred pain in which the vagus nerve or the trigeminal nerve in the throat and palate, respectively, transmit pain signals because of the rapid cooling and rewarming of the capillaries in the sinuses. General phantom limb pain is a type of referred pain. It is a sensation of pain from a limb that has been lost or which can no longer receive physical signals. It is experience that is almost universally reported by amputees and quadriplegics. McBurney's point is a painful location indicating appendicitis. It occurs 1/3 of the distance between the right anterior superior iliac spine and the umbilicus or belly button. The left tip of the shoulder pain indicates a splenic injury and is commonly referred to as Kerr's sign. Appendicitis is an inflammation of the appendix. The appendix is a 3.5-inch long tube of tissue that extends from the large intestine. No one is absolutely certain what the function of the appendix is. One thing we do know, though, is that we can live without it without apparent consequences. Appendicitis is a medical emergency which requires prompt surgery to remove the appendix. Left untreated, an inflamed appendix will eventually burst and spill infectious material into the abdominal cavity. This can lead to peritonitis, or a serious inflammation of the abdominal cavity's lining. Peritonitis can become fatal unless it is treated quickly with strong antibiotics. In the United States, 1 in 15 people will get appendicitis. Although it can strike at any age, appendicitis is extremely rare under the age of 2, but is most common between the ages of 10 and 30. Appendicitis occurs when the appendix becomes blocked, often by stool or foreign body or cancer. Blockage may also occur from infection, since the appendix swells in response to every infection in the body. Classic symptoms of appendicitis include dull pain near the navel or upper abdomen, which becomes sharper as it moves towards the right lower abdomen, loss of appetite, nausea and/or vomiting soon after the abdominal pain begins, abdominal swelling, fever, inability to pass gas. Almost half of the time, other symptoms of appendicitis appear, including dull or sharp pain anywhere in the upper or lower abdomen, back or rectum, painful urination, vomiting, severe cramps, and constipation or diarrhea with gas. Appendicitis is treated usually through surgery. Surgery removes the appendix, which is called an appendectomy. It is a standard treatment. Generally, if the appendicitis is suspected, doctors tend to err on the side of safety and quickly remove the appendix to avoid its rupture. If the appendix has formed an abscess or is filled with pus, you may have 2 procedures. A bruised liver or a liver contusion occurs after a direct impact to the torso, resulting in bleeding within the organ. Car crashes are the most common cause of this injury. Symptoms of a bruised liver include sudden pain on impact, pain and tenderness in the upper right quadrant of the abdomen, referred pain into the inferior angle of the scapula, most often on the right side, hypertension or low blood pressure. In severe injuries, when a lot of blood is lost, the patient could develop shock and possibly lose consciousness. Severe injuries could actually be a laceration or tear of the liver. Treatment for the liver contusion including seeking medical attention immediately. Your doctor will examine you and may perform an ultrasound or CT scan to assess the damage. If the injury is just a contusion with no tearing, then close observation is recommended for several days. Blood tests will be repeated daily to check for blood loss. The CT scan or ultrasound may be repeated after a few days to check the liver is healing and to make sure that no additional bleeding is occurring. Contusions tend to be relatively minor injuries which heal within a week or so. The pancreas is a large gland behind the stomach and next to the small intestine. The pancreas does two main things. First, it releases powerful digestive enzymes into the small intestine to aid in the digestion of food. Second, it releases the hormones insulin and glucagon into the bloodstream. These hormones help the body control how food is used for energy. Pancreatitis is a disease in which the pancreas becomes inflamed. Pancreatic damage happens when the digestive enzymes are activated before they are released into the small intestine and begin attacking the pancreas. There are two forms of pancreatitis, acute and chronic. Acute pancreatitis is a sudden inflammation that lasts for a short period of time. It may range from a mild discomfort to severe, life-threatening illness. Most people with acute pancreatitis recover completely after getting the right treatment. In severe cases, acute pancreatitis can result in bleeding into the gland, serious tissue damage, infection, and cyst formation. Severe pancreatitis can also harm other vital organs such as the heart, lungs, and kidneys. Chronic pancreatitis is a long-lasting inflammation of the pancreas. It most often happens after an acute episode of pancreatitis. Heavy alcohol drinking is another major cause. Damage to the pancreas from heavy alcohol use may not cause symptoms for many years, but then the person may develop severe pancreatitis symptoms. What are the symptoms of pancreatitis? They include upper abdominal pain that radiates into the back. It may be aggravated by eating, especially foods high in fat, swollen and tender abdomen, constipation, nausea and vomiting, fever, increased heart rate, shock, and jaundice. Jaundice is a yellowing of the skin, the whites of the eyes, or the underside of the tongue, indicating issues with the liver. Sometimes diarrhea is also present if pancreatitis becomes chronic. People with acute pancreatitis are typically treated with IV fluids and pain medications in a hospital. In some patients, the pancreatitis can be severe and they may need to be admitted to the ICU or the intensive care unit. In the ICU, the patient is closely watched because pancreatitis can damage the heart, lungs, and kidneys. Some cases of severe pancreatitis can result in death of pancreatic tissue. In these cases, surgery may be necessary to remove the dead or damaged tissue if an infection develops. The spleen is a delicate fist-sized organ under your left rib cage near your stomach. It contains special white blood cells that destroy bacteria and help your body fight infections. The spleen also makes red blood cells and helps remove or filter out old ones from the body's circulation. A layer of tissue entirely covers the spleen in a capsule-like fashion, except where the veins and arteries enter the organ. This tissue is called the splenic capsule and protects the spleen from direct injury. A spleen rupture is an emergency medical condition that occurs when the capsule-like covering of the spleen breaks open, pouring blood into your abdominal area. Depending on the size of the rupture, a large amount of internal bleeding can occur. The spleen rupture can occur when the abdomen suffers from a severe direct blow or blunt trauma. The spleen is the most frequent organ to be damaged in blunt trauma injuries involving the abdomen. This is true regardless of your age. The following are among the frequent causes of spleen injuries: motor vehicle accidents, injury during contact sports such as football and hockey, bicycle accidents such as falling onto your bicycle's handlebars, or domestic violence. Certain diseases and illness can also lead to ruptured spleen. In such cases, the spleen becomes swollen and the capsule-like covering becomes thin. This makes the organ especially fragile and more likely to rupture if the abdomen receives a direct hit. Diseases that increase the risk for ruptured spleen include infectious mononucleosis. In some cases, a ruptured spleen is the first sign of the illness. Blood or hematological diseases such as hemolytic anemia and certain types of lymphoma, malaria, and recent studies have also linked colonoscopy, or a procedure that looks at the large intestine, to an increased risk of a ruptured spleen. A ruptured spleen causes abdominal pain, usually severe but not always. The severity and even the location of the pain depend on how bad the spleen has been ruptured and how much blood leaks out. Pain may be felt in these locations: at the left side of the abdomen underneath the rib cage, the left shoulder, because the nerves of the left shoulder and the left side of the diaphragm originate from the same location, and the rupture may irritate these nerves. Internal bleeding caused by the ruptured spleen can cause blood pressure to drop. This can cause blurred vision, confusion, signs of shock, including restlessness, anxiety, nausea, and paleness. In the past, the treatment for a spleen injury always meant removal of the entire organ, called a splenectomy. However, doctors now say that some spleen injuries can heal on their own, particularly those that are not very severe. People with spleen injuries who do not need surgery must still be monitored in a hospital, just in case they may need blood transfusions. Immediate emergency surgery to remove or repair the spleen is done in the following cases: if the doctor thinks that there is massive internal bleeding, or if the person is suspected to have a spleen rupture, has low blood pressure, or unstable vital signs. When the surgery is done, the entire spleen is usually removed, but in the case of small tears, the surgeon may try to save the spleen instead. This involves repairing the tear and putting pressure on the spleen or blood vessels until the blood clots and stops leaking. Another procedure called arterial embolization may be a safe way to save the spleen, but can only be done if it's performed immediately. A bruised kidney or kidney contusion occurs following a direct impact to the lower back area. This is most commonly from car accidents, although may also occur from a fall or a physical attack such as being kicked in the back. Symptoms of a bruised kidney include instant pain, pain in the lower back area, usually on one side, nausea, vomiting, blood in the urine, and muscle spasms in the back muscles. Seek medical attention immediately. A doctor will examine the patient and may request an x-ray to check for associated injuries such as fractured ribs. Other tests such as MRIs or CT scans may also be ordered to check for internal bleeding. In cases of a simple kidney contusion, the patient is usually monitored closely for a few days. The kidney will usually heal on its own without further complications within a week or so. A kidney stone is a hard crystalline material that is formed within the kidney or urinary tract. 1 in every 20 people will develop a kidney stone at some point in their life. Kidney stones form when there is a decrease in urine volume and/or an excess of stone-forming substances in the urine. Dehydration is a major risk factor for kidney stone formation. Symptoms of kidney stones include flank pain or pain in the low back and abdomen. The pain can sometimes be quite severe. Nausea, cool, clammy, and pale skin, and blood in the urine, sometimes called hematuria, cloudy urine, or frequent urination, or at least the urge to go. People with certain medical conditions, such as gout, and those who take certain medications or supplements are at risk for kidney stones. Diet and hereditary factors are also related to stone formation. Diagnosis of kidney stones is best accomplished by using ultrasound, intravenous pylography, or a CT scan. Most kidney stones eventually pass through the urinary tract system on their own within 48 hours with ample fluid intake. Treatments include pain control medications and in some cases medication to help facilitate the passage of urine. For kidney stones that do not pass on their own, a procedure called lithotripsy is often used. In this procedure, shock waves are used to break up large stones into smaller pieces that can then be passed through the urinary system. Urinary tract infections are caused by bacteria and are 10 times more common among women than men. The urinary tract consists of all the anatomical structures of the body that participate in the creation of urine. These include the kidneys, ureter, bladder, and urethra. The kidneys filter the blood, removing the waste products that result from the body's complex metabolic processes. This filtrate is the urine, and as it passes through the kidney on its way out of the body, it is refined, concentrated, and adjusted through many complicated biological processes. The product of all this activity, the urine, passes down the ureters, is stored in the bladder, and is eventually excreted through the urethra. Urine is normally sterile, but bacteria on the skin or in the GI tract can enter the urinary tract and infect it. The most common pathogen is E. coli, but there are many others that can cause urinary tract infections as well. The most common symptoms of a urinary tract infection or UTI are burning pain or pain when you urinate, pain in the lower abdomen or pelvis, an urge to urinate more frequently, although when you try to go to the bathroom, very little urine may come out, cloudy or foul smelling, or even bloody urine. When these are the only symptoms, the infection is usually confined to the lower urinary tract, primarily the bladder. If, however, you also have a fever, nausea, vomiting, or pain on one or both sides of the low back, then the infection may have ascended up the ureters or to the kidneys. Why do women seem to get UTIs more frequently than men? The reason is simple. The bacteria that live on a woman's skin only have a short distance to get to the bladder. Women have a much shorter urethra than men. Plus, the urethra itself is closer to the rectal opening, a common source of bacteria that causes UTIs. What should I do if I think I have a UTI? You should see your healthcare provider. The diagnosis is usually confirmed by peeing in a cup and then using a urine dipstick to test for bacteria and white blood cells. Your healthcare provider may also check your temperature and examine you to make sure that you have a bladder infection and not an infection that is extended to the kidneys. We need to take care of this as it can become serious if it is not addressed early. What your urine says about you. Normal urine color ranges from pale yellow to deep amber, the result of a pigment called urochrome and how diluted or concentrated urine is. Pigmentations or other compounds in certain foods, medications may change your urine color. Normal urine color varies depending on how much water you drink. Fluids dilute the yellow pigment in urine, so the more you drink, the clearer your urine looks. When you drink less, the color becomes more concentrated. Severe dehydration can produce urine the color of amber, but sometimes urine can also turn colors far beyond what is normal, including red, blue, green, dark brown, and cloudy white. It is important to assess your urine color for general health.